My name is Dr. Bruce Fishman. I'm an orthopedic surgeon here at BKP Medical and Orthopedic Group. We take care of injuries involving accidents, whether it's car accidents and slip and fall, to try to get people's life back to the way it was. We're going to be discussing elbow pain today. Elbow pain is caused from injury or inflammation that involves the structures around the elbow, even from everyday use. This includes the tendons. You've heard of tennis elbow, golfer's elbow. These are the tendons and the ligaments around the joint, the elbow joint. Care and treatment of these musculoskeletal injuries is undertaken at our clinic with multiple modalities and successfully treats these types of injuries. Now, in routine medical care, we treat these with various combinations and protocols to help patients. These include physical therapy and rehabilitation, chiropractic, medications, activity modification, and even with all that, some patients still remain with ongoing pain and difficulties. For those patients that the pain and the symptoms remain severe, surgery is usually the next recommendation. However, nowadays we do have more modern treatment utilizing biologics. And these biologics can help diminish or relieve the pain and even diminish the need for surgery or eliminate the need for surgery in its entirety. One of the more common ones that are known is platelet-rich plasma, also known as PRP. We also use alpha-2 macroglobulin, known as A2M. Now, these two biologics come directly from the patient's blood. Blood is drawn, it is put through a special spin and a centrifuge, and the PRP is taken out separately. The serum is then taken, and that's put through special filters to concentrate the A2M. Now, PRP, or platelets, these are very small parts of cells. In your bloodstream, you have white blood cells, red blood cells, and these platelets. The red blood cells carry your oxygen. The white blood cells fight your infections. It's the platelets that do the healing. Now, in addition to the PRP and A2M, which is taken from your bloodstream, we also use cellular therapy. These cellular therapy can come from something like your own bone marrow, where the stem cells are taken from, or from the umbilical cord. We tend to use a lot of umbilical cord related allogeneic types of cellular therapy. It includes the nanoparticles, which actually come from those live cells themselves. These are fostered and taken by certified, registered FDA laboratory, a transplant laboratory, that takes these cells and they are tested multiple times for safety. They're tested by a second lab for safety, and then they are cryopreserved, so when the time comes a patient is going to be treated with them, they are thawed and then carefully injected into the area where the patient's injury, symptoms, or inflammation are, to start the regenerative process and heal those particular tissues. Additionally, the regimen doesn't only include the biologics. It includes such things as hyperbaric oxygen. We take our patients that have just had these biologic treatments and we put them in the hyperbaric oxygen chamber at 2 ATA, or 2 atmospheres of pressure, for 60 minutes. This allows increased oxygen to be dissolved within the blood, which then can help activate the patient's normal tissues as well as the biologic tissues which have just been placed as well. We also provide patients the option of undergoing low-level laser therapy. Now, this low-level laser is a Weber laser, which the FDA has approved for interstitial as well as intra-articular use. Most lasers are just used on the skin or topical. These can go into a joint, intra-articular, or into soft tissues like muscles, ligaments, and tendons. And we use various laser wavelengths, usually red, infrared, near infrared. And these help regenerate the injured and damaged tissues, as well as help activate some of the biocellular elements which were placed previously. With all these treatment protocols, most patients do exceptionally well.